Thank you very much, and it's really wonderful to be, talking about a very important topic that is pertinent to the African Climate Foundation. I wish I could do lovely slides like Almaz. I don't have slides, so I'm just going to talk from a few bullet points. I think my talk is also a reflection of the sort of thinking we are trying to engage as an African Climate Foundation in terms of our work beyond South Africa and the rest of the continent. And I'm also involved with the Welcome Trust, which is has set up a whole initiative around climate and health. And the Welcome Trust is actually getting pretty active around building strong evidence-based work in terms of climate and health issues. And there is a context for it because, and particularly for the African continent, there's a very important link between climate and development, and I will talk about that. The Climate and Development Nexus is a very important pivot and framework for the foundation that I run, which is, by the way, only 1 year old. We are a philanthropic foundation. And I will explain that in a minute, because I think when we look at climate and health, we have to take also a political economy view, because the distribution of health services, the capability of households to actually cope with health stresses, which come from a variety of fronts. Climate is just one of them. Has real impacts on household income and their ability to be able to sustain themselves, their family, and invest in many other things that are important for households to migrate from a poverty trap to better well-being for themselves and so on. And health is a very important aspect of that. And on the African continent, we need to understand the effects of multiple factors that impact on communities and individuals in a context of poorly serviced health infrastructure and systems, and how we can build this notion of a climate and health resilient framework and link it fundamentally to dealing with poverty and other issues that households may face. If you look at the history of climate and health in the early phases of the debates and discourses around international climate issues, in fact, when the first United Nations framework for climate change was signed, it wasn't even on the radar. People didn't even think about climate and health issues as they do now. In fact, it took the third scientific report of the International Panel of Climate Change to seriously bring this into the mainstream discussion. I still feel that we are a very long way away from actually developing a systematic approach to integrate this in national data, and also in the way we think about health systems and their ability to deal with climate and health issues. So we're still a long way, and there's been an interesting report by the Rockefeller Foundation. I think it was done in conjunction with other institutions. It was called the Planetary Health Approach. And it was this report really tried to also bring the importance of natural systems, ecosystems, and the effects of climate change on these ecosystems, and then draw the link between that and human health. But more importantly, fundamentally trying to connect the health of natural systems to impacts on human health, and to try to bring these two issues in a more connected way. And the reason for that is that over the last couple of years, we've noticed that disruption of natural functions and ecosystem, particularly through increased human interaction with wildlife, has led to occurrence of new diseases. The current pandemic may have been originated from humans consuming certain types of wildlife, for example, and Ebola is a good example. And long before that was HIV/AIDS. The only time when climate and health started getting greater attention actually was in 1996 when you had the Chicago heat wave, and I think about 3,000 people died from that, if I was not mistaken. And that was really when people realized the notion of excess death because of heat, thermal effects, that there was a strong connection between climate change, rise in temperature, and the real dramatic impact, sudden dramatic impact on human beings. And we've seen this in the last decade. Similar forms of heat waves in France and in many other countries have affected it. But on the African continent, we don't really understand the full picture of thermal effects, transmission of vector-borne diseases because of climate change, and also the consequences of extreme weather patterns on climate health and human health. So I think some stronger research and work needs to be done on this in order to be able to develop health policy and investment in the health sector that can accommodate a new external shock and vulnerability that is poorly understood, both in terms of its direct impacts on human health, human productivity, human systems, and in this case, production systems, because on the continent, for example, the largest labor intensities in the agricultural sector, which is still an important livelihood, means of livelihood and survival, and also for the sustenance of food, for the resilience of food security. And thermal effects, for example, have impacts at two levels, crop yields and labor productivity. And given that agriculture is largely small-scale farming, impacts on labor is very critical to improvements in agricultural productivity, particularly in small-scale farming. So I think this nexus of climate, resilience, and health is important. And if we took a more rights-based approach, we'll begin to understand that the nexus between climate and health has significant impacts on socioeconomic rights, and also the ability of households to support themselves to improved income is dramatically impacted. In fact, Rwanda, for example, has piloted what is called a community-based health insurance scheme. And this report was done by the African Development Bank to show that collective health schemes, which are supported by the state, can reduce financial catastrophe for poorer households quite dramatically. And the evidence that they showed was to the extent of 20% of household incomes was saved as a result of this kind of insurance scheme. So we not only have to improve our conceptual notion of the climate resilient health framework, we got to understand that in a more granular way through better evidence, so we can target the right investments, given that many African countries and governments have limited resources, and also so we can develop a link that strongly to household resilience, particularly from an income point of view, that out-of-pocket spend on health issues can be minimized over time, and to think of safety nets like community-based health insurance. So there's a real holistic approach that needs to be taken. It needs to be integrated with other development investments, and this connection still has to be reinforced because it's not where it should be. And I wanted to pick up on something that Marina raised about air pollution. There's a really interesting case study, and I raised this because there's a court case that is happening about air quality in South Africa at the moment, where a group of activists who have labeled this the deadly air case is an advocacy campaign to improve air quality, ambient air quality in the major coal producing power generation geographies of South Africa, in this case Mpumalanga, because this is an ongoing case in which the externality costs of these coal plants have been socialized. The burden of them has been socialized by poorer communities, and not even the state nor private firms who are really the culprits that are producing air pollution. Now, what's the importance of this case is that it's probably a precedent-setting case in terms of strategic litigation, and tries to make the connection between air pollution, health, and climate in a very, I would say, pioneering way. And I think the ability, and it's taking a very strong rights-based approach, because it's defending this in relationship to the constitutional provision in terms of the Bill of Rights, in the duty of the government to protect individuals and society from health impacts, particularly air pollution. And it's something really to watch. It's a case that is being taken up by the Center for Environmental Rights, and there is the court case, I think, is in May, where there will be a hearing of this case. I would say lastly that one needs to understand climate and health and resilience, household resilience, not only as just a scientific issue, but also an issue of political economy. And if we can understand that, as Marina has noted, there's a interrelationship between science, proper health, resilient systems, and the political economies of countries. And I would even go and say that where rights are poorly protected, you're likely to see that the impacts of climate and health are more significant in these countries and these communities. So if I can leave it at that, because I know we have very limited time for Q&A, so I want to give opportunity for the audience to ask questions. Thank you very much.